Welcome to this explainer. Listen, if you're exploring fertility care right now, I would be your supportive guide today as we gently walk through the steps of a semen analysis together. It is completely normal to feel a bit overwhelmed or even anxious when you're navigating new medical tests, especially ones that are so deeply tied to building a family. But please, take a deep breath. We're going to break this all down simply and clearly so you know exactly what to expect. All right, let's dive right in. Taking this first step in fertility testing, that is a huge milestone. We really want you to know that beginning this process takes courage, and acknowledging that milestone is so important. This explainer is all about giving you the knowledge you need, completely free of confusing medical jargon, so you can feel empowered and confident moving forward. You are in the exact right place to get clear, reassuring answers about your health. Okay, part one. Welcome to semen analysis. Let's start by demystifying what this test actually is and why your care team has probably recommended it as a first step for you. Basically, a semen analysis is a totally standard, super common lab evaluation. Technicians just look under a microscope at freshly ejaculated semen to check the overall health of your sperm. They're specifically looking at three things: shape, number, and movement. It's the go-to tool for diagnosing male fertility, though, as a side note, it's also used to confirm if a vasectomy was successful. Now, you might be wondering, why on earth is my doctor asking for two separate exams? If you hear this from your care team, please don't sweat it. This is completely standard practice. It's just designed to ensure they get the absolute most accurate picture of your well-being rather than relying on one single snapshot in time. The reason for those multiple tests really just comes down to natural fluctuations. A guy's semen quality naturally bounces around a bit between samples. I mean, even if you are perfectly fertile, temporary factors can easily get in the way. Things like feeling under the weather, a recent fever, or a minor infection can actually lower your sperm quality for a few months. Since sperm production cycles take about 2 to 3 months to complete, an illness you had weeks ago could literally be impacting today's sample. So one test doesn't always tell the whole story. Moving right along to section 2, what the test actually measures. Now that we know what the test is, let's look at exactly what the lab is hunting for when they examine your sample. First up, sperm motility. This is basically a comparison of the moving sperm, the moto ones, against the non-moving ones. Think of it as measuring how well your sperm are swimming. Active swimmers are absolutely crucial here because the journey to the egg is incredibly long and challenging for these microscopic guys. They need strong forward momentum to reach their destination naturally. Next is sperm concentration. You've probably heard this referred to as your sperm count. This metric simply tells your doc how many individual sperm are packed into just one single milliliter of the sample. Because the journey through the female reproductive tract is so tough, having a higher concentration naturally boosts the odds that a healthy sperm is going to successfully make it all the way. The lab's also going to check something called sperm vitality. This is a very straightforward count that tells the technicians exactly how many of the sperm in your sample are currently alive and kicking. It's a critical piece of the puzzle. Even if your overall count is high, vitality ensures that the sperm actually have the biological potential to fertilize an egg. Then there's the physical shape, often called morphology. Technicians meticulously evaluate this by comparing the amount of ideally shaped or normal sperm to the ones that have a more oddly shaped, abnormal form. Shape plays a huge role in how effectively sperm function and penetrate an egg. And hey, I want to be clear, it is completely normal to have a high percentage of abnormally shaped sperm, just as long as there's a good baseline of ideally shaped ones to get the job done. Finally, they'll round out the whole analysis by checking a few more vital stats. They'll look at the overall total sperm number and the total semen volume, so the full amount ejaculated. They also check the pH level. The pH actually needs to be slightly alkaline. Why? To protect the sperm from the naturally acidic environment of the vaginal tract, ensuring the fluid is perfectly balanced for their survival. All right, section 3, preparing for your sample. With the biology covered, let's shift gears to logistics so you know exactly what to expect on test day. When it comes to preparing for your sample, there is one crucial number to remember: 72. To give your doctor the absolute highest quality sample possible, medical guidelines strongly recommend you hold off on ejaculating for a minimum of 72 hours before your test. This abstinence period gives your body time to build up an optimal reserve. When it's go time, the best, most standard method is producing this sample via masturbation directly into a provided specimen jar. And here is the absolutely critical part: you cannot lose any of that sample. You've got to be especially careful to catch the very first part of the ejaculate. Why? Because that initial part naturally holds the highest concentration of sperm. If it gets lost, your results will falsely look much lower than they actually are, and that could lead to totally unnecessary worry.
Got another big number for you, 60. Many clinics offer a private, comfortable room right there at the lab. But if you choose the comfort of producing your sample at home, you have to keep it warm, like literally tucked close to your body, and rush it back to the laboratory within exactly 60 minutes. Semen testing has to be done on a fresh sample to be totally accurate.
Which brings us to Section 4, the WHO benchmark standards. Once the lab securely gets your sample, they keep it at room temperature to get the most precise results. Then they measure your numbers against a really reliable baseline set by the World Health Organization back in 2021. For example, ideally, the volume should be around 1.5 milliliters. For concentration, they're looking for 15 million per milliliter. Progressive motility, those strong forward swimmers, should hit 32%. In your normal forms, the perfectly shaped ones should sit at around 4%.
Hey, before we talk about interpreting your results, I need to mention something super important. If you are highly anxious or feeling sick right at the time of collection, it can actually pose adverse effects on your test outcomes. The mind-body connection is very real, and stress or a temporary bug can genuinely skew these numbers. This is exactly why doctors so often ask for that second test we talked about. They just want to make sure they're seeing you on a normal, healthy day.
Finally, Section 5, understanding your results. Okay, so the testing is done, and you're sitting down with your doc to review your personalized results. It is incredibly important to remember, this test alone is just one piece of the puzzle. It does not guarantee fertility or infertility. Getting pregnant is a massive team effort that relies on a much bigger picture. We're talking about the frequency and timing of sex, how long you've been trying to conceive, and the overall fertility and age of the female partner.
And that brings us to one of the most hopeful takeaways from the medical literature. Even if your sperm concentration comes back lower than the WHO benchmark, natural conception is absolutely 100% still a possibility. A lower number does not mean zero chance. It just means your doctor has better information to help guide your family's unique strategy.
So, armed with a clear understanding of what a semen analysis is, what it measures, and exactly how to prep for it, I really hope you're feeling empowered. Taking this step is all about gathering helpful information and stepping back into the driver's seat of your fertility journey. So, are you ready to take these insights and have an open, empowered conversation with your doctor? What other steps could you and your partner take today to advocate for your reproductive health? Thank you so much for letting us be your guide on this explainer, and we wish you the absolute best on the road ahead.